Ko Rochelle Martin, toko ingoa. It's a pleasure to welcome you to this final session. And I put my name down to chair this session because it's a personal favourite. One of the things we really wanted to do at the start of, over this day is to celebrate the actions that people are taking that are really making a positive change. And of course, we want to highlight the gaps and we want to talk about the problems, but we also want to celebrate the people and the organisations that are doing positive or are taking positive steps. And so in that regard, we've asked for expressions of interest from people to say, have you got a good news story to share? And this session is made up of those people sharing their good news stories. And the other person was David Hood, who shared in session 1. So thank you very much, David, for putting yourself forward as well. We're going to start by hearing the story of Te Whatu Ora Waitaha with Leah Hackney. So Leah's a registered nurse at what used to be called the CDHB, the Canterbury District Health Board, and she's currently working as a team leader in the Return to Work team. Now, Leah talked at our Journeying Through the Fog symposium last year, and this is a bit of an update, really, sharing what some of the outcomes have been from that work. So I'll let you lead off, Leah.
Thanks, Rochelle. Okay, we'll just share our screen here. Okay, so kia ora everyone. So Rochelle's done a lovely introduction for me there. So my name's Leah Hackney and I've been running and being the nurse coordinator and team leader for the COVID Return to Work team for 1 year now. We're coming up to our 1 year anniversary in a week's time. So our team here is a unique program where we support staff in their acute phase of COVID, so up to day 30. And the idea behind that is just to provide support and navigation for staff as they work through their COVID isolation period and then potentially ongoing symptoms as they recover from COVID. So what I'm hoping to share with you in the next 4 minutes is just some insights to what we've seen over the past year, and also what we've tried to educate managers and staff about, that an isolation period doesn't necessarily mean that the illness is over. So how many staff have actually been affected by COVID that we've seen? So what I do have to acknowledge is that we are an opt-in service. So we've had nearly 5,900 staff register with our team and come through our team over the past year, which is an enormous privilege for our team to have supported these individuals. And from that, we've seen nearly 6,400 infections. So we know that that's 45% of our workforce have been affected across both Canterbury and West Coast. But we also know that that is probably a not quite true estimation, because we know more people would have been impacted by COVID because they have not registered with us. And if you're really quick with your maths, you would have seen that we've had some reinfections across that time as well. And it's already been talked about earlier today that reinfections are important to note because it could lead on to more impacts from COVID. So we're sitting at about a 20% reinfection rate for our staff, and we're just monitoring that really closely at the moment. So when do staff start to come back to work? It's a really interesting question. And again, it's really important to note when we're starting to see staff come back to work, because it is important for decision making for our leadership team. And so staff do their 7 days of isolation, and the earliest that they can come back to work is day 8. And we're only seeing 52% of staff returning to work at day 8 when they're well enough to start coming back to work. And initially people thought that there would be a higher number, but of course we've absolutely proven that that's not the case. We want staff to be well enough when they come back to work. That's the most important thing. And you can see from our trend line on the right hand side of your screen there that that number is actually lower than 50% at certain times during the year. Across winter last year, we definitely saw that that was less. So the median current day that Kaimahi will return to work is actually day 9. And just briefly across the other side of the page again, you can see from that histogram that we've got about 35% of staff that don't return to work until at least day 11 onwards. So we know that staff can be quite impacted by COVID, and we know that better than most because we continue to talk to staff throughout their COVID journey every 3 to 4 days to offer what support that we can. So what happens if staff are not well enough to return to work after day 30? So again, like I said at the beginning, our service is here to support staff during their first 30 days of their COVID journey. We have 2 avenues. So we have the care of manager outcome, which is for staff who are already on their graduated return to work program. So an individualized program that may have already been prescribed by their GP, or they've talked to us and we've advised them about how they can safely get back to work. These are staff that feel safe and confident to continue down that pathway, and they will continue until they're back to work. That our door is always open. They can call us back if they have an exacerbation of their symptoms, they feel like they need extra support. So we can see that there. The other team is the illness management team. And this is, again, an opt-in program for staff, and it's for staff who may not yet be back at work, may have severe symptoms, or just feel like they need extra support in the workplace to continue on their COVID journey and their back to work program. So we know that about 3% of our staff still require support to get back to work, which again is less than what we thought we were going to do when we first set up this program. So whilst we recognise that there is a lot of staff that still need support, the early intervention appears, I say that really carefully, appears to be helping staff to get back to work in a supported way. And I'm really, really happy to see that managers are supporting gradual return to works from when staff may get back to work even at the day 10 stage. So what challenges do we face now? And it's really nice to lead in off the session that's just occurred, because the access to long COVID clinics is really starting to become a challenge for comprehensive rehabilitation for staff who are still suffering at that day 30 point, if not more. And that will continue to be a challenge in this space until that is addressed. And then access to funding. We're starting to notice now anecdotally in our team that staff are putting off going to the GP because they do not have their own means of paying for going to the GP, because we all know how expensive that can be. And also our return to work team, we finish on the 31st of March currently, so there'll be that void in that space for staff. So I'm going to finish there. I look at the time and I believe Rochelle, I'm probably just sitting there, but what we want to do is just normalise early supportive wellness management for healthcare workers so that they can continue to care for others. Really, really thankful to the staff that have put their trust in us, and I knew that I wouldn't get to these slides, but these are just some quotes from staff that have filled out a survey to make sure we're doing the work that we can do to support them. And it was just overwhelmingly positive support for our team and what we've been doing over this past year. So yeah, thank you so much for letting us share what we've been doing.
Kia ora, thanks, Leah. I think it is wonderful to hear that these positive early support can make a real difference to people. But also there was a question earlier in the chat about, is anyone actually asking staff whether these things make a difference? And the systematic way that you've set up the service has allowed you to really monitor what's happening for the staff that you're caring for, and has made a real difference to decision making across the organisation. So, and how staff supported. So, well done. Now, the next presenter is Dominic Kelly, and you're not supposed to have personal favourites. That's completely wrong. But I think Dominic's is my personal favourite. Because he's going to help us. He's taking amazing steps to keep us all safe as we party. And so, Dominic, I'll introduce you a little bit more. He's the proprietor of the Hashigo Zake. Is that how you say it?
Close.
Oh, close enough. You're my favourite, but I can't say the name of your bar. I'm sorry, but we're really keen to hear about it. So off you go.
Okay, thanks very much, Rochelle. I guess I should start about maybe this time last year, give or take a couple of months, when the measures that we had in place, things like mask wearing, distancing, they were all being wound back, and we needed a new story to tell about how we were going to keep our staff and our customers safe. And there was a bit more talk back then about ventilation, especially purification. So we made that our next project, if you like. So phase one of that project was I was attracted to the idea of Corsi-Rosenthal cubes. So hang on, yeah. So I'm not a hardware person, but I had a crack at building a wall-mounted Corsi-Rosenthal box, which is what you see here. I don't propose to go into the details of what these do, but we kind of ran into a limitation, which was that it's hard to measure how well they're doing. Plus, a back of an envelope calculation said we need an awful lot of these if we're going to have a full, if we're going to have a lot of people in the premises. So about this time, Oliver Zeiler got in touch, who may even be listening in today. Oliver makes these CO2 monitors primarily for school use, but for someone like me, they are particularly attractive because they are capable of connecting to our Wi-Fi and publishing the measurements they take to any process that wants to, any software that wants to listen in. So this was, yeah, super attractive for a one-time boffin. So we got two of these. The reason we got two is that hopefully this is self-apparent what's going on here. We have a reasonably, our premises are quite broken up. Allegedly, these once held police cells. We're in the basement of a former police station built in around 1920. So we've got foot-thick brick walls and some reasonably separate spaces. So we put two CO2 monitors in, and then we set out to use the data that they produced. And this is what I came up with. We already had an on-screen electronic menu. So we plotted the CO2 readings from our two sensors across the day, and this updates in real time or near real time, maybe once a minute. And so any member of staff and any customer can see right there what our CO2 is doing. Generally, customers aren't particularly fussed, but for us as staff, we can look across the room, see it ticking up on one or both of the sensors, and then we can take action. Mainly that action is to turn up the ventilation. But also what we'll often do now as well is use the heat pumps and depending on the time of year, use them as heaters or air conditioners or just fans. But what we found is that any kind of additional fan movement seems to help the ventilation do its job. As an aside, this is a thread I got put onto a Twitter user in the UK talking about the outcome from when schools there were given £49 million worth of CO2 monitors with, from what the Twitter user says, not a lot of a plan for what to do with it. So I'm quite big on displaying the data that we extract meaningfully without alarms and without too many flash graphics that look great but don't give a lot of info. So that's hence my preference for a plot like this. And here's an example of what might happen during the course of an evening. We see a sharp rise partway through the night. Turns out that a group that arrived a few minutes earlier are all breathing heavily. So we take the action I was talking about. We turn up ventilation, we turn on the fan, and a few minutes later we get hopefully a nice clear fall again in the level of CO2. I mentioned earlier the effect of any kind of heat pump operation. This is what happens when we have the air conditioning going. I think it must be a function of the thermostatic control of the aircon, but it drives wild spikes in the performance of the ventilation. This is what happens when everyone in a small room starts dancing. These numbers Oh, if there might be a red light flashing on the top of that image, if it's visible, that's the CO2 meter having a heart attack. But at first glance, this looks really, really high. From what I gather, though, figures of about 2,000, 2,200 parts per million are comparable to public transport in a lot of cases. So I'm not actually embarrassed by the fact that it spikes quite so much. For grins and giggles, we created a Twitter bot followed by a Mastodon bot that shares averages. And then just to finish on a downer, this is the review we got. Kind of weird to see all the COVID stuff still around. Anti-COVID air purifiers, bit much at this point. Move on, guys. Sorry to finish on a downer like that. Yeah, what can you say?
Fantastic. Thank you so much, Dominic. I just think that's such a positive story of preventative action to reduce the risk of people getting COVID in the first place. We'll carry on. I'm sure there's going to be some questions for you as part of the panel, but Jonathan is all organised and ready to go. And Jonathan is a Communications and Marketing Senior Advisor at Punaha Matatimi. Have I got that right? Goodness, I need to practice my my vocab, my introductions, don't I? We're seeing your full screen there, Jonathan. We had it right.
Thank you. I just lost my unmute button, so
okay. You're right.
I'll just share that again for you. So, tēnā koutou katoa, kei tamaki makoro aho e noho ana, he kai tohu mātua whakawhitinga, whakatairanga aho I te Punaha Matatini, ko Jonathan Burgess tako ingoa, tēnā koutou katoa. So I'm Jonathan, I look after comms for Te Punaha Matatini. Very humbled to follow after New Zealand's best bar, Hashigo Zake, but great to hear what you're doing there. So Te Punaha Matatini is a national centre of research excellence, which brings together researchers across institutions and private research, across universities and private research institutions. We bring together people that are interested in complex systems or complexity science. So basically we build community across disciplines to solve complex problems, things like language and biodiversity and climate change and the spread of infectious disease. So central to Te Punaha Matatini are three communities of inquiry and complexity, the scientific basis of what we do, but also engagement and the culture of research excellence. As part of the culture work we do, we've put out various policy documents to try and influence the research culture in New Zealand, which we make freely available and encourage people to make use of. So we've heard of a lot of places successfully using this stuff. Into this context, a central part of what we do is get together in person. The main event of our year is our annual hui. So in July 2022, when we were thinking about getting one together, we put a lot of thought into it and then thought we should put out some guidance to help people that are also planning large events, because this is a common thing that happens in academia, large conferences and get-togethers. There's been some really good ones, and there's also been some really notorious super spreader ones. So good to put some thought into preparing for that. So this document's available on our website, and I'll link to it at the end of the presentation. But I thought I'd just, given that I don't have too much time, I'll just take you through some highlights of some of the main points that I think are relevant. And I'll note that the document is quite comprehensive. If you followed it, you'd have a very gold standard event, but that also any or as many of these interventions that you can do will increase the safety of your event. So take a look and choose the ones that work for you, and any of them that you do will help keep the people attending the event safe. As a communications person, I'm going to highlight first that it's important to tell people in advance what you plan to do, because people will be making decisions about whether or not to attend your event based on what you're doing about COVID safety. Like Dominic was talking about with Hashigo Zake, choose a venue that has good ventilation, ask questions about ventilation. This can be mechanical ventilation, but this can also be opening doors and windows and things. And then probably my favorite one, this is quite effective, just ask everyone to take a rat each day before testing. This is a simple thing for people to do. And also make them freely available at the event on the day to make sure that everyone has access to one. I'll note that through the second half of last year, at every event that we held, we found an asymptomatic positive case through this testing. So they were able to not attend the event and not spread it on to anyone. Ask everyone to wear a mask while indoors. Again, make them freely available. And high quality masks, KN95s, N95s, P2, and all of that. There was a little bit of debate about whether to let people remove them while speaking, which we decided to do, which I didn't do here. And just a note to use the microphone if you're not wearing your mask, because there are issues with people not being able to understand you if they can't see your mouth and everything. So, but speaking is a dangerous activity. So while we're spreading COVID. It's also pretty much compulsory these days to have an online option available. Eat and drink outside at your event is a simple one. Have a plan for accommodation if someone is away from home and tests positive. And really importantly, have a discussion about who exactly will pay for this in advance of your event so that you know what's going to happen. And then finally, it's really important to communicate to your event attendees. If it's a multi-day event and someone tests positive during the event, let people know so they can decide whether or not to continue attending. And after your event, notify them if anyone tests positive so that they can take appropriate precautions. And then finally, there's a QR code where you can access the full document or a link, or you should be able to find it on our website. Cool. Thank you very much for having me.
Brilliant. Thank you so much, Jonathan, and for your speedy walk as well. So I'm really, really grateful for that. It's fantastic to get those really key messages about the multi-levels of things that we can do to keep ourselves and the people that we're working with safe, and they're relevant for lots of circumstances, not just academic conferences. So thank you. We've now got Stuart Ekdahl, who's going to talk. He's a fellow of the Royal New Zealand College of Urgent Care and co-founder of the White Cross chain of accident and medical clinics. And Stuart's going to have a chat with us about something called the COVID-19 Pledge. Thanks, Stuart.
I'm Stuart Ekdahl, so Stuart Ekdahl Toko Ingoa. I'm an urgent care guy, and I'm here to tell you a wee bit about the COVID safety pledge. And what I would like what we would like to see is that we would like you to have this poster at your workplace. There's no cost for this other than adaptive behaviour, because we believe that everybody deserves to be safe from dangerous airborne viruses, both at work and in all public spaces, because COVID is still with us, despite denial by some organisations and statements that this is not so. So in your workplace, you precautions are insufficient for us to be safe from the SARS-CoV virus. And because some workplaces are also public places, like retail and restaurants, I guess buses and trains, this can effectively exclude people, maybe up to 20% of us at different times from work and public life. For these reasons, businesses, in our view, must take responsibility to use additional precautions where we agree to protect workers, to assess our workplace, support our staff, and take action to minimise infection. Furthermore, we also believe that by making it known that they're taking COVID-safe workplace precautions, and perhaps by displaying the pledge, that we expect businesses will do better with staff retention and recruitment. Quite important these days, I believe. We listen to the science. This is from 2020. And we're upfront about the motivation for the pledge. which is about suppressing transmission and actions to do so, and the benefits, including human productivity and goodwill benefits that flow from the pledge, such as reduced transmission with mechanical ventilation and reduced sick leave. And what to do to achieve these benefits. It looks complex, but it's really very simple. It's about ventilation, filters, N95 masks, and perhaps UV light, testing isolation and sensible mixing. So this is what I have on the website, and thanks to Sergio Coscolan for agreeing that I could share this. So essentially, just to repeat myself, improve ventilation, measure CO2, use filters and N95 masks. So ably demonstrated by Dominic Kelly. I am actually going to jump on a plane and come to your bar because you're doing such a fantastic job. Thank you, Dominic. We also talk about how to, what to do, in other words, the practicalities of things, for example, including the principles of ventilation like increased transmission risk and slow moving air, shown here in red. Slightly complex, but that's a cross-section of a room. Air comes in top left and goes out top right, and the red bit's where the air's not very well mixed. And Dominic, I can't help but wonder if where your CO2 meter lives is not being that well mixed, and when you turn on your aircon, it may be mixing better, just a thought. So yeah, air's not always well mixed, despite academic papers suggesting that it always is. So in essence, I hope you're motivated to support the pledge, and you can imagine how you might use it, like perhaps ProCare, New Zealand's largest network of qualified GPs and general practice teams, plug for them, as well as the Royal New Zealand College of Urgent Care and others are supporters. And the British equivalent, covidpledge.co.uk, is well supported by British Medical Association, Unite Union and others. So essentially, what we're asking is, or what we're stating is that there are easy to do actionable steps for business to minimise the human and business costs, both short and long term, from airborne disease. And when you think about the pledge at your workplace, I hope you realise this is something we all need. And thank you for that. As just an afterthought based on what Dominic said, in Hong Kong, they deployed 6 air changes in all eating places, and they effectively eliminated what they call inter-table clusters just by that manoeuvre. Indeed, the public transport figure of well over 2,000 parts per million mentioned by Dominic is indeed observed, and I myself have taken the train and measured 2,300 parts per million after 15 minutes on the train going into town with 65 people on the carriage. So it doesn't take very long to achieve very high CO2 levels and therefore high risk. Thank you very much for listening.
Fantastic. Thank you, Stuart. Really great to hear that there's some ways that we can contribute as well, and perhaps profiling the COVID-19 safety pledge to your employers is one way you can do that. Right. Finally, but sort of coming right back full circle, really, we were inviting Hayley Wolters, who started our symposium today so beautifully, to come back and share a toolkit that she's been involved in creating that is really, well, I'll let Hayley explain it maybe rather than trying to, but it's for employers and employees around getting back to work after COVID. So Hayley, off you go.
Kia ora koutou, ko Hayley Wolters toku ingoa. As Rashaz just mentioned, it falls to me to start and end the speaking slots for the COVID and Work Symposium. I just wanted to say what a privilege it is to be here today. Before I start my presentation, I just wanted to reflect how personally heartening it is that there's such a clear recognition of the need to respond to COVID and long COVID in the workplace. It's also been incredibly heartening listening to all the speakers today who are getting ahead and doing it, making recommendations, putting policy in place, collecting data to influence change, the COVID-19 safety pledge that we've just heard about. I think that there is incredible power in being the leaders in the room who are deliberately empowering change. And I don't think that that can be underestimated or understated. Ngā mihi nui to you all for your mahi. I'm here in my capacity as an admin for long COVID support Aotearoa. One of the most frequently asked questions when someone joins is, what do I do about my job? With input from lived experience voices in the group and worldwide, we've created a document that is designed to help both employers and employees at a long COVID 101 level to have conversations. I'm just noting that this is designed to be a 45-minute presentation, and so I'm doing this at the speed of light, and I've got Rochelle on my screen so I can see when she's doing her frowny face at me, and I will ensure that I stop it. And I also just wanted to note that this aligns with themes and ideas that many speakers have already suggested throughout the day today. And it's so great to see that we're on the same page in this respect. I'm also just noting for posterity that I am going to unashamedly steal some of the ideas that I've heard today to put in this document to strengthen it. So again, just thank you all for the ideas that you've shared today. This document will also be available as a link for anyone to access and use after we finish. So I did just want to note again quickly, knowing that we're running short on time, but as we've heard today, that COVID is not mild or like a cold. It's not just feeling a little bit tired, and it's not resolvable within a set time period. I think that's incredibly important to understand. 1 in 10 people who experience COVID-19 will go on to experience long COVID. Recent studies suggest this could be as high as 1 in 5. Things that workplaces need to know. There are workforce implications for long COVID. So 25% of UK employers cite long COVID as driving absences. New Zealand does not yet have policies in place for long COVID patients. And so key messages from lived experience is that rest is imperative for recovery. Leadership to support long COVID patients now and in the future is vital. And it's also important to note that access and support pathways are not clear and not embedded, and in some cases don't exist yet. So it is still an ongoing journey, and I think that we've heard enough kōrero from people today to highlight the need for some of that policy to start being put into place. And very quickly, best practice considerations, just flexibility around workload is something that we wanted to highlight. Providing a safe way to converse about what people are feeling is incredibly important, as well as removing the stigma around long COVID by talking about it. So deliberately creating that space, deliberately having those conversations is incredibly important. Some things to consider as part of your thinking. Again, pacing, as has been noted by previous speakers, is critical to aid recovery. Criteria for support should not be dependent on a positive test. There is no test for long COVID. And then also dedicating time, as I've just noted, to ensure that a primer comes into play for managers and staff. And then additional wraparound support should also be considered. 2 minutes. Thanks, Rochelle. And so in terms of some of the experiences that people have shared in the group, it's important to note that there is a great deal of perceived pressure. As other speakers have noted, people do want to work, they want to contribute, they want to make sure that they're doing their jobs well. And there's a perception if they're not working at 100%, they're not performing. And so that needs to be addressed in conversation. it's also important to note, again, as I've just said, that there's not systemic safety nets in play. And so in terms of process, it's important that what you're doing to aid people's job descriptions and tasks, it needs to be very clear with staff. And then also ensuring that a plan is in place prior to discretionary sick or other leave running out. I also just want to pause to note here that if there is if it comes to the point where employment does need to be discontinued, it is incredibly important to ensure that that exit plan is well executed. It is important that both employees and employers feel like they have done everything possible to get to a good outcome, and that employees are supported to leave and they've got a positive experience in doing so. And then finally, just we'll wrap up, but there's an actions list included in this document, some support options. There's a lot in the news about long COVID, and that's not going to stop occurring. And also just wanted to reiterate that the pandemic isn't over. New variants are going to continue to arrive in New Zealand. A new normal is here, and long COVID is part of that. And so best practice should be considered now. I'll stop there. Ngā mihi nui, and thank you all.
Thank you, Hayley. And I do apologise that we've made you rush through that, but I know that you're also very open to having people be in contact. And Hayley is a serious Twitter user. So if you want to connect with Hayley, Twitter is a good place to do so. Rob, can I pass it to you for just some final gathering thoughts? Or we won't have time for any questions, but if you've got questions, pop them in the Q&A and we'll get the different speakers to respond to those. Give Rob a final wrap-up statement, and then we'll ask Toa to close our time together today.
I'll introduce Toa in a second, but I just really wanted to say I'm very grateful to you for your attention over 7 hours. It's been a very long day. I think we're all very tired, and but I think it has been a worthwhile day. It will be worthwhile if we make a difference. I think what we do need to focus on is moving this forward, having a political voice, and actually making a change, because I think we need to not just talk the talk, we need to walk the talk. And really, I just throw out a challenge to all of you to keep talking to your political representatives, local representatives, professional bodies, and whatever, to make sure that the agencies who need to make these changes and employers who need to make these changes actually do move forward. I'd really like to see implementation of the rehabilitation framework for long COVID that was published last year. And I think that there's more work that needs to be done on that. So please keep up the pressure. We will try to keep up the communications, but I know that somebody else is picking up the cudgel and will be organising a meeting later this year, again on the subject of long COVID. That will be, I think, very valuable. Our website will be a way of staying in touch with us, and we will podcast, edit, publish, and podcast all of these presentations so that you can come back and see them again if you need to be re-enthused or re-informed. And I really ask you just to let's keep this debate moving along, because I really do want to make a difference. So it gives me great pleasure to actually close this meeting altogether, to introduce Toa, who opened the meeting for us this morning. He's our manager of our Māori strategic framework for the University of Otago, Wellington, and he will now close the meeting.
Kia ora, Rob. Kia ora whānau. Ki ngā kaikōrero mō tēnei rā, tēnā no hoki koutou, mō koutou pūkenga, mō koutou mātauranga hohonu, o koutou māramatanga mō tēnei o mate ko whiore. Nei rā te mihi atu ki a koutou. Kia ora tātou. Unuhia tūru tapu nui a tāne, kia wātea, kia māmate ngā kau te hiningaro te tinana te wairua ki te ara takata. E runga kua wāte, ai e runga kua wāte, e rongo wakihiri ake ki runga kia tina, tina. Haungi e hui e, ai e. Mauri ora whānau. Stay safe. Kia ora.